Hi, everybody. Thanks for being here with us today, Molly. My name is Taylor Spaziani with the Sexual Health Alliance, and we're here today with Molly Adler for her 5 minutes of fame with Shaw. Thanks for being here with us today. Uh,
Sure.
I'm just going to start asking you some really cool questions about yourself. So, if you'd like, would you just mind by starting by telling us about yourself and your career and what you do?
Sure. Hi, I am Molly Adler. I live and work in Albuquerque, New Mexico, which is also ancient Puebloan territory, formally and traditionally and continually. Um, Hi, Kitty. Stewarded by the Native Americans here in my state. And I am a therapist, a social worker, and a community member. And I currently have a private practice called Sex Therapy New Mexico. And I see clients in a private practice, individuals and couples and folks in non-monogamous relationships. And I primarily work with the LGBTQ community and folks who are kinky and non-monogamous. And I also do continuing ed trainings. I've been in New Mexico about 13 plus years. And my last career was that I co-founded Self-Serve Sexuality Resource Center here in Albuquerque,
Oh, wow.
or selfservetoys.com. So
Cool.
that's kind of my background. Came from sex ed and moved to social work and clinical practice in the last 5 years.
Oh, awesome. Sounds great. And you're doing some really good work out here.
Thanks.
A little more personal, I guess. What are like the top three bucket list items that you have?
I had trouble with this when you mentioned this idea
Mm.
because there's both so many infinite things that I want to do, and also many of them are um, everyday things. Like I thought of, I used to do painting, acrylic and oil painting, and I was like, I want to get back to painting. So that's one. And then was another one that feels a little more exciting is I really want to go visit Hawaii at some point, and I love waterfalls, so I want to see epic waterfalls in Hawaii. And let me think if there's something else. Yeah, I would say also kind of revealing some nerdiness, but I really like rocks, and I live in New Mexico. And I'm actually wearing turquoise earrings by an artist from Santo Domingo, Pueblo, right now that are turquoise, so very New Mexican. But I would love to go to southern New Mexico where there's a lot of rock hounding and amateur folks can go and find gems and minerals. And, I don't even know what I'm going to do with them.
I'm
But I
sure
want to
that's so much fun. Yeah, I love that.
yeah.
You sound like a real big nature person.
Yeah, I like nature.
The earth is really cool. One of the favorite questions I have to ask people at Shaw is who is your sexual role model?
Hmm. Yeah, that's a great question. Um, I probably couldn't pick one, but some of the top people that come to mind. One is Adrienne Marie Brown. I'm currently reading Pleasure Activism, which is an amazing book, and I really love how she brings together concepts from pleasure and centering pleasure with empowerment and social justice and community healing. So I think there's some concepts brought out in that book and collection that's really powerful. And the other person that's been a big influence on my work and way of looking at things with sexuality is Lori Brotto, who's believe a psychologist, maybe a doctor. I should have researched that, but Lori Brotto is in Canada, and she's done a lot of research on mindfulness and sex, and so she's influenced a lot of my work and perspective with helping bring those tools and mindfulness practices to improve people's sexuality and pleasure. So she's definitely a role model with the work that she's done.
Oh, that's awesome. And I can tell it's positive because your work around mindfulness is
Yeah.
amazing. So,
Yeah.
being in the field, what is some of the worst advice you've heard people give out?
Another tough question. I would say anytime the advice sounds like there's one way to do something, and I guess what I mean is, which I think I see less of and I saw more of, in previous years, but when there's sex ed or sex advice that says, this is the one way to please a woman, this is the one way to have trans sex. This is the one way to have a body. This is the one way to recover from sexual trauma, or you know, have use your erection the right way. Like, I just feel like there's it's problematic to even approach advice or sexuality from that kind of one size fits all approach. So and I guess I would apply that to most intimate and emotional kind of mental health experiences. I think we all have our own process and our own unique perspective and emotions, and so there's no one right way to have a body, to have a sexuality, to have a sex life, to process grief, to recover from trauma. So anytime we hear a message that's like you're doing it wrong, I think that's a dangerous message. So
Totally agreed, and
yeah.
very beautifully said. I think that really highlights, just how diverse we are as humans. And I
Yeah.
think that's the beautiful part about therapeutic journeys is there isn't one size fits all. So, yeah, thanks
Yeah.
for sharing that. So, here at Shaw, we train all kinds of healthcare professionals and healthcare providers sexuality education due to the fact that a lot of people in grad school don't get any 0 to few hours of sexuality training. So, if you were to give some of your best advice or something you would want healthcare providers to know, what would be something you would tell them or want to share?
Hmm. Um, what would I want other sexual health care providers to know, and
And
therapists,
just
like
healthcare
I said
providers
earlier?
in general. Yeah.
Well, I guess I know, I'm relatively new to the field. I mean, I've been in sex ed for like 15 years, so I'm not really new to the field in that way. But as a therapist, I still feel like my career is relatively young. And so coming into this field, um, I guess, I mean, in my own journey, I've learned a lot about just privilege and how the intersections of our identities, our experiences, and where we live and work, how they influence the work we do and the relationships with the people we work with, the power dynamics of when I'm in front of a room educating folks or doing a training. And so I think the thing that I think is growing but still lacking in our field is awareness of our privileges. So as a cisgender white person, for example, I'm wanting to learn more about how systems of oppression affect people of color and transgender folks. And I think of when I do trainings, and I think there's a big demand for a lot of folks who are, say, monogamous, to learn about, okay, I want to work with non-monogamous folks. Like, I don't get it. Like, and I love that. I think when we can learn how to say, I don't get it, this is not something I've experienced, or this isn't my identity, I don't understand, I think we're going to be so much better for it. And we're going to do so much better by the people we work with when we admit what we don't know and are open to curiosity and learning and growing ourselves. So, and I think for the sexuality field in particular, it's remarkably white and privileged in terms of class. And so I would love to just see more diversity and acknowledgement of that. And, I'm also a big fan of transformative justice and inclusion. So that means that I don't think people who are older or, heterosexual or white should be kicked out. I just think we all could learn from each other. And so, I just think, our field has a lot of growing to do in that way, where sexuality work is 100% intertwined with social justice and racial justice. And I just hope that we'll continue to practice that and learn how to do that. So, I'm trying to do that in little ways with my practice and my own education, and then trainings that I do. But I think that systemically, we need a lot of work and a lot of help. So that's what I wish for more of our colleagues to pursue, I think, which may not be found, obviously, directly in the sexuality field. Like, I know that there are amazing sex educators doing this work, like Bianca Loriasmo has done work, the Anti-Up series, if people haven't heard of that, is a way for people in the sexuality field to like get ASEC CEs and also learn about intersectionality and racial justice. So some people are doing this work and have been doing it a long time, but yeah, I think our field has a lot of work to do. So
Yeah, totally agreed. And you just touched on some really important pieces, I think. I think you're also a really good role model for others in the field too. It's just even the littlest things that you can do to be support and learn and continue to learn.
Yeah.
I think that's amazing.
Yeah, I think, we do learn a little bit in school, like to check our own biases. And obviously, folks who are in the SHOP program have to do a SAR at some point. So I'm glad that we have to assess our attitudes and biases. And I think a lot of those are not necessarily just about like you're straight and you learn about someone who's gay and what that's like. Like, I think there's a lot of complexities to that, including all of our identities. Which I still do think like it's really important that we have more kink aware therapists and folks who understand more about non-monogamies. But yeah, I think that's all going to intersect with people's culture, spirituality, race, ability, you name it. So
Totally, totally. So this is the part where the red carpet is laid out for you. If
ooh,
whatever you'd like to share with the world, tell us what you're doing, what you're working on.
sure. Yeah. I mean, I kind of maybe already said it, but I'm a therapist in private practice in Albuquerque, New Mexico. I am currently working on future continuing ed training. So mostly right now I'm doing continuing ed trainings locally. So I offer trainings for mostly therapists and people in mental health and focus on helping with competency for other clinicians in sex therapy topics, but also working with LGBTQ clients, working with non-monogamous clients, and kinky clients. And some of it feels like cultural humility, cultural competency work. And some of it is like common issues that I see in my practice among clients. So I know that there's a big demand for a lot of folks to get therapeutic support around, say, jealousy and attachment insecurity and non-monogamy, but there's not a lot of resources. So I'm also trying to work with other clinicians to build their capacity because at least in Albuquerque and in New Mexico, we have a shortage of clinicians that kind of work in these areas of sexuality, relationship. So I'm doing a lot of that. And when I post trainings and stuff like that, they're at sextherapynm.com. That's my website where there's info about my practice and trainings and stuff like that.
Amazing.
Yeah.
Well, awesome, Molly. Thank you so much for being here and being a part of the Sexual Health Alliance. We appreciate and value you. And
Thank you.
yeah, thanks for being here today. Have a
Thank
good
you.
rest of your day.
You too.